In the 1980s, I used to be in a band that no one's ever heard of that was called Not Shakespeare, that was pretty popular and did a lot of touring and spent a lot of time on the road, working with bands that are now very famous when they were not so famous, such as REM, bands like Modern English, and the Kinks, of course. Everyone's heard of them. My diagnosis with prostate cancer came along at a time when I wasn't feeling so well. I was feeling run down. I'm kind of an active individual, and I noticed a lot of changes in my stamina.
Rik was a 61-year-old gentleman who presented to our office as a referral for an elevated PSA level. Initially, it started with just asking patients a little bit about themselves and where they come from. And during our conversation, it was obvious that we had been in the same space in the same time. We noted that I had seen his band and I had been to see his concert or his band play before.
I was discussing with Dr. Long about what I did in music back in the 80s. He asked me the name of the band and he said, "Yeah, I saw you guys one time." And I thought that was pretty crazy.
And so that was a little segue into developing a nice rapport. And I think that also allowed him to become a little bit less nervous and a little bit more open about the situation that he came to see me for. Rik, after a careful thought with his family, decided to undergo a robotic-assisted laparoscopic radical prostatectomy with bilateral pelvic lymph node dissection to treat his prostate cancer.
I have children that rely on me and a girlfriend that relies on me and responsibilities that I needed to fulfill. That was probably my biggest fear, was not so much dying as much as not being here for the people that need me.
So the surgery itself for Rik was a success. Early on at the 3-month mark, he showed signs of near complete continence. By 6 to 9 months later, he had returned his sexual function in addition to not wearing any urinary pads at the time. And on top of all, his cancer has not showed any signs of recurrence since then.
Now that I'm a survivor of cancer, I value my days more. Things take on a little brighter tone, a little happier. To have that behind me, for sure. Just try and look forward and be thankful. Music is a very big part of my life. There's a lot of things I can't do anymore. So I spend more time, more focused on my music, which is great. My advice for someone else going on this journey, going through cancer and treatment and all that, is just to stay positive, just keep fighting and be brave.